Hi, I have Mr. Hans with Tapestry joining me this evening. Hi, Mr. Hans.
Hi, how you doing?
I'm doing well. Can you tell me a little bit about yourself?
So I'm Hans Jenkins. I'm a physician who's a chief medical officer with Tapestry Health. I go by Hans most of the time. I've been with Tapestry Health since January. Before that, I spent time with Teladoc Health, HCA, and then the military before that.
Wow. Okay, so can you tell me a little bit about Tapestry?
So Tapestry is a technology-based company that works in the long-term care space. We use technology to help our clients focus on the patients. That's kind of our main mission, making sure we have give the clients the tools they need to get great patient care, such as OPCO.
Okay, and what tools do you provide?
So we provide all kinds of tools. We provide AI-based system as well as human checkups and human clinicians, human nurses who also check our AI tech. And we use different types of devices to collect data on the patients, such as the chart. We use remote devices that work in the rooms. We use passive devices that kind of sit in the room like radar and can determine a patient's heart rate and blood pressure without touching.
Oh, so it's like a remote type of, is it like when you put like a heart monitor that you can monitor
Kind of
a
like that. It
patient?
sits in the ceiling. Yeah, so it's the same radar they use in Teslas to do self-driving. So it uses a radar like that where it can actually determine people's skin tone, blood pressure, heart rate, respiratory rate, how often they're moving in the bed for bed sores, how often they're being turned. You determine fascinating amount of number of things.
Now you bring up bed sores. So in nursing skilled
Yeah,
facilities, you see a lot of bed sores.
yeah,
So, how can you prevent these patients from getting the bed sores by you monitoring? Is it
exactly right. Like what do you do
right?
with the data?
Like,
That's a lot of data. How often they move, right? And
right.
that's where the AI comes in. AI is really good at taking large amounts of data. You're 24/7 monitoring this patient. The AI can predict based on the patient's other diagnoses, right? Like low protein levels, skin integrity, age, diagnoses, to determine how much they're moving can be calculated if that's a risk for med sore. And then we have a dashboard that allows our clients to look at that data and be able to see if that's going to be at risk for that patient.
Okay, good question. I have a question for you. So, where is this dashboard? Is it something that they just have to log online to check, or is it part of their EMR system?
So it works directly with their EMR. For most major EMRs, we work directly with them, and it's online, so it's real time. However, right now they have to log into a separate login. It's the same login they use for their EMR typically.
And they can
But
see this on all patients.
yeah, all patients that have our devices, the patients have to opt in, obviously.
The opt-in. Okay, I was wondering because I'm like, "Oh my god, this could prevent bed sores," because so many patients in nursing skilled facilities have bed sores. So that's why I was just wondering, "Oh my god, are they monitoring this? Are they looking at this dashboard and and how often?" So it's just on certain patients.
Yeah, the ones that opt in, which usually is about 70% to 80% of the buildings for OPCO, their patients are opt.
And how is this covered?
So it's paid for by building advanced practice codes with Medicare and Medicaid. So we build the insurance companies, and it's paid for. The patients don't have any out-of-pocket costs, or the facilities actually.
I think this is great. So is this something that the facility has to be signed up for? Okay. And of course, there's a cost for
There's no cost to the facility. So Tapestry, we put all the money up front, all the capital investment to get the devices, to get everything put in the building, and then we make it back over. The only cost of the building is just the time it takes the nurses to react to the reports and stuff.
okay. And then when you're saying that they just only put it on certain patients,
So it goes to all the
wh-
rooms.
so it'll go to all of the rooms. Okay. I'm just trying to better
Yeah,
understand.
exactly. No,
'Cause this
yeah,
is like great because I hear so many people complain about their loved ones not being turned or they have this bed sore. How did they get this bed sore? And it's huge because getting a bed sore, it can turn into other
yeah, and it's
problems.
hard.
And it's hard.
Very
It's pain.
verbalize it.
Correct.
That's another thing we do. Sorry. Go ahead. That's another thing we do too by monitoring some of the vital signs. We determine if they're in pain or distress, especially in nonverbal adults. So the AI can look at all that massive amount of data and determine if someone's in pain or distress by the change in vital signs over
I think that is great. I just learned something new
time.
today. That is great.
It's pretty fascinating. Yeah. No, it's
Yes.
It's just growing.
And what are some of the biggest challenges skilled nursing facilities face right now?
Oh my gosh, the biggest ones, besides everything else we just talked about.
Right.
So I think the biggest challenge I've seen, and this just goes back to I have family members in nursing homes, right? And the biggest challenge is trying to balance everything, right? Because you've got nurses who are working extremely hard on shift, techs, CNAs are working really hard, and the reimbursements are not going up for the cost of caring for loved ones. It's not just for the facilities, but the families themselves. So you have these, like my family members, we can't be there all the time. And so we have to put our trust in these nursing homes that's increased burden, increased cost, and trying to do more with less is difficult and stressful. Anytime you have decreased resources in any job, your job stress goes up. So you have high burnout rate. A lot of my friends who are nurses burned out. They're looking for other stuff. That's sad because they care so much. And that's why they're burned out. If they didn't care, they wouldn't get burned out. So that's our goal with Tapestry, is to make sure that we take these challenges, the decreased resources, and make it so they can do more with less. Be able to care for people, going physically and watching them 24/7.
So, do you think there's still a staffing issue? I thought since we've gotten past COVID that things probably have improved in nursing facilities as far as staffing. Do you think that it's still an issue, a concern?
Yeah, well, that's a tough question. so, so the patients in nursing homes getting sicker, but the ratio of patients to nurses is about the same or less because of the cost. And so there's not a staffing issue with no one's applying. It's just the cost. We can't afford to pay the people to take care of the sick patients. Because 30 years ago, when I first started working in nursing homes, those patients were not as sick as they are. And the staffing ratios were better back then. And now we're doing sicker patients. We're doing PIC lines. You just had the PIC line people in here, right? We're doing PIC lines in a nursing home. That used to be in med surge 30 years. And we don't have the staffing we had 30 years ago. So how are we supposed to staff this? That's any job, right? You come in and say, hey, you got to work twice as hard with half the hours and get it done, or you're going to get in trouble. It's hard because they care about the patients. And it's burning them out.
Wow. Hans, I want to thank you for sitting down with me and having this conversation. I really enjoyed it. And I just want to let you know that OPCO values your company, Tapestry. And I just want to say thank you from Synergy Innovators.
Thank you for inviting me.
You're welcome. You have a great day.